we can advance to tracking and predicting the spread of COVID-19. This will be the focus of the next talk, which will be given by Dr. Parris Lyew-Ayee Jr., Managing Director of Mona Geoinformatics Institute. Dr. Lyew-Ayee, a former head of the Department of Geography and Geology here in the Faculty of Science and Technology, is responsible for overseeing all commercial research and development activities at Mona Geoinformatics Institute, MGI, and led the development of the region's first GPS navigation system, JAMNAV. In his active research, Dr. Lyew-Ayee works on natural hazard analysis, crime and security systems modeling, road safety analysis, health systems mapping, transport systems and modeling. Ladies and gentlemen, it goes on and on. Data analytics, GPS systems, and so many others that are relevant to Jamaica, the Caribbean, and the world. The methodical and data-driven approach that the government of Jamaica has employed to successfully manage the local spread of COVID-19 has been supported by Dr. Lyew-Ayee and his team at MGI. Ladies and gentlemen, Dr. Parris Lyew-Ayee is the person to speak on the topic tracking and predicting COVID-19. Please give him a warm welcome.
Good afternoon. Thank you for allowing us the opportunity to share our experiences and adventures in dealing with COVID experiences for the last couple of months. We've had a very exciting few months that we'd like to share with you in terms of what we've been doing at the Mona Geoinformatics Institute in tracking and predicting the ravages of COVID-19 in Jamaica in particular, but generally around the world in terms of contextualizing what's happening out there. What we have been doing is looking at the cases of COVID in Jamaica, but we want to put ourselves in perspective here. Where are we compared to the rest of the region? Are we doing very well? Are we doing badly? The answer is kind of in between. We're doing better than some, like Dominican Republic and so on, but we're also not as good as other countries. Cuba is doing particularly well per capita, and other countries in the Caribbean. So we need to benchmark and baseline ourselves in terms of cases over the region. We've been seeing where we in Jamaica had the April spike in cases, and we saw something like that happen in Haiti. We see something like that happening in Antigua and different countries. We need to establish how do we compare in terms of how do we proceed in terms of analysis, in terms of tracking and predicting cases going forward. So to do this, we look at the overall ecosystem. We look at the number of direct flights to Jamaica on the left of your screen. You will see where we have regularly scheduled flights as well as seasonal flights from Europe, from North America, from South America, from Panama. All these places are coming in to the Caribbean directly. And this was early on into the cases of COVID around the world. So before we started to lock down, we started to mobilize to see what's going on in terms of the rest of the world. We had cases in Bull Bay, but a definition of Bull Bay is a little bit too general for the quarantine area. So we went and defined the different sections of Bull Bay. We're talking about 8 Mile, 9 Mile, 11 Mile, West Haven, St. Benedict's, all these different components of what we are colloquially calling Bull Bay. We need to define the area, square off the area of quarantine and begin to define what's going on. Then we had this lockdown in St. Catherine. And we want to figure out how do we look at logistics of enforcing a lockdown. So we went and isolated all the inter-parish road crossings between St. Catherine and St. Anne, St. Catherine and St. Andrews, St. Catherine and Clarendon, and so on. Identify those points where people are likely to move across the border, and then figure out what they're going to be doing after that. We also then looked at the CCTV camera footage across the country to look at pictures of the lockdown, pictures of the curfew at night. It was quite something to see, where you're able to see all these deserted roads at 8 p.m. and halfway tree and Crossroads and Old Hope Road and so on, all these completely empty roads and so on. So it was very important that we began to see what's happening out there in the field in real time. But by none, the most exciting and most rewarding project we've ever been in my career has been working with the private sector organization of Jamaica's COVID Response Fund. They've raised over $182 million, benefited over 50,000 people in terms of giving them care packages and so on. It was a remarkable collaboration, especially with different members of the private sector, donors and so on, but also in particular the Jamaica Defense Force and the Jamaica Constabulary Force that provided extraordinary logistics and other capabilities. But this showed to me the important value of teamwork and cooperation. We were able to hand off to the JDF for them to execute their logistics and hand off to the donors to be able to gather supplies and distribute them in real time. So what this did, what we did here was to identify the 25 most vulnerable communities in Jamaica. Now this is going to be very important because these are the people who are going to be most affected by the COVID lockdown, whether or not they themselves have COVID. And it was something that we really had to pull out all the stops to get this thing right. But what it also allowed us was the identification of key groups of people right now in concert with so many different variables here. It's not enough to say we want to find the old people and that's it. We wanted to find where are the diabetics, where are the hypertensive, the disabled people, the poor people, the uneducated people, people who are subject to the ravages of crime. All of these things were put together. And in order to do that, we had to individually isolate each of these groups of people. So what you're seeing on the screen right now are the individual addresses for diabetics, for hypertensives, for disabled people in Jamaica. These are the registered people. But we're talking several 100,000 each. Identified by address, and therefore we're able now to lock in how we're going to address and handle these people. So all of this led to the development of the model, which incorporated 22 different variables. We're not talking about just the old people or just the diabetics. We're talking communities that have old people and diabetics and hypertensives and disabled and poor and uneducated, all of those things combined. So you do have several poor communities that don't make the list because they don't have a high number of diabetics or they don't have a high number of disabled people and so on. You have to have that combination for this to work. We use several 100,000 individual reference points that resulted in over 20,000 combinations of variables. And we were able then to test several dozen scenarios. What would happen if the whole country locks down? What would happen if Kingston and St. Andrew is next after St. Catherine? What would happen with the individual cases of Onoto Bay when Onoto Bay went under quarantine? All of these things were being tested in real time using the model. The model is fed by the data, the mapping information, but ultimately the model is a dynamic system that allows us to begin to test scenarios in real time, whether or not you are a mapping person or not. But fundamentally, the model allows us to be data-driven in our approach and justification for the selection of communities for assistance. It frees us from the influences of politics or from people's individual personal networks or friendships. It allows accountability to the donors for them to be able to account for the spend and their involvement in a project like this, free from any kind of political associations and so on. And that was one of the most beneficial things for the project in terms of being able to be transparent and allow accountability to the many donors who are part of this project. So the top 25 communities included, and Old Harbour and Linstead topped the list. And this was before the April surge in cases. And those communities ended up being the top communities case-wise. This is before we even knew all of that. But then we began to use variables like crime, unemployment, all of those things to begin to whittle down this figure here and identify these are the communities we need to go in. JDF goes into those communities, does their logistics, deploy them using the Jamaica Constabulary Forces and the different donor agencies. And we're out there helping 50 over 1,000 people. And that was really rewarding. So this is the mapped output of those vulnerable communities. The areas in red, the communities in red, are those that we identified as areas that we need to focus on in terms of COVID relief, whether or not you had cases. So even though St. Catherine was the real overall hot spot, we knew that it was going to be a hotspot, whether or not they actually had cases, simply because these places have the most number of people who are old, who are hypertensive, diabetic, poor, disabled, unemployed, and so on. And we're able now to pre-mobilize into these areas. Now, when we look at this thing in July, we identified 16 of the 25 communities are now trending downwards, and that's a really good thing for us to hear. 4 months into the pandemic and 2 months into the relief distribution, three communities are still trending upwards. We're watching those things, whether or not we need to refocus into these areas. But by and large, again, as I said earlier, we're looking at accountability and transparency. We're here trying to show that the 25 communities that were selected are being monitored right now for performance, for results, which is what we really were after here in the PSOJ program. Now, knowing vulnerable communities is one thing, but individual assets are going to be critical as well. You can be in a very low vulnerability community, but a nursing home is particularly vulnerable, whether or not you're in a good community or not. Children's homes are extremely sensitive to these things, and as we saw in April, the BPO locations are also areas that we need to watch. So we have eyes on these places. We're not showing COVID cases right now. We're just showing the location of individually vulnerable infrastructural assets right now, and to be able to say, okay, we got to focus on these areas. If you have a nursing home in Linstead, that's exponentially worse than a nursing home in the middle of Savannah Lamar or so on. Then we look at sector impacts right now. We can say, yes, schools are going to be affected, hotels are going to be affected, beaches are going to be affected. Let's see where these are across Jamaica. So we can then show you entertainment locations that will be closed down, or groceries and wholesale stores that are going to have to ramp up because people are going to be stuck at home more cooking. They're going to need food. Let's see where those are. Let's see where the emergency services are in totality. We're not looking at one or the other. We're looking at all of them combined. And then when we combine them all by community on the top right, you can then begin to see which communities are going to be most affected. You know which businesses are going to be affected. Now let's see which communities are going to be most affected. We're moving at individual property scale, going out to community scale, going to parish scale, and going backward. It's very dynamic. And it's something that we're very excited to explore, those kinds of possibilities for the kinds of responses that we want to envisage and incorporate as a country. And in the bottom right, you can see a lot of reds. Those are the individual assets in Jamaica that would be negatively affected, one way or another, by the COVID situation. So a lot of schools are going to be closed down. A lot of churches are going to be affected. All of those things are accounted for in these individual asset mapping. Nothing here so far is showing actual COVID cases right now. It's all showing the infrastructural or social, economic impacts of the pandemic. But then we can now look at the cases themselves. So this is neither here nor there. It's when we put it together. Overall, as of July 11, these are the communities that have had COVID cases. Again, Old Harbour and Linstead top the list, and we do see Greater Portmore, we do see Waterford, we do see other areas in red, but we do see that COVID has touched every single parish in Jamaica, and we now need to see what's going on. When you zoom in now on the Kingston, St. Andrew, and St. Catherine regions, you can see that this thing was all over the place, but not everywhere. And it's very important to see that kind of distribution of cases. This is distribution by community. So previously I was showing it individual assets, individual churches or nursing homes in Linstead, in Old Harbour, and so on. Those situate themselves on top of this kind of information, and then now you're able to see what's going on in the middle of the storm. So when you look at the individual cases in March, you see the cases in Rocky Point and Hayes and in Bull Bay and so on. But as we go into April, we see the boom in St. Catherine. We saw what happened with the BPO outfit in Portmore, resulting in Portmore community, Spanish Town, Old Harbour, and Linstead in particular, really exploding in terms of cases on the map. And then we started to cool, those areas started to cool off except for Old Harbor. But then we started to see cases popping up in the North Coast now. So Runaway Bay, Discover Bay, St. Anne's Bay, those areas started to pop up. And then we moved into June and we start seeing a little bit more migration to the north and to the west. And into July, we're starting to see Westmoreland and Hanover communities starting to pop up into the picture, while St. Catherine has pretty much cooled down. But looking at the difference between cases between April and March, you can see that explosion in St. Catherine. But you can also see between May and April how much St. Catherine cooled down. But other areas started to go orange and red now. Going into the next series of months and progressing, we can see that the case counts by community is really migrating across the country. It is very important not to just look at national information, national scale information, when we're trying to look at local scale planning and local scale activities. And so July to June, you can see areas are cooling off, but areas are warming up, and then you can see the cases popping up in the west, which were up until then fairly cool. We also want to look at the trends of cases. So we see through the month of March, individual communities trending up in red or trending down in green. Some cases popped up early in March and nothing happened after then, so they trended downward in March, which is a good thing. But then in April, you see everything is trending up in St. Catherine. And we want to see what's going on in those areas. What happened in St. Mary in April as well? Everybody's thinking about St. Catherine. It's not just St. Catherine. In May, you could see, again, things started to trend down in St. Catherine, but in other places in Jamaica, in other communities, in other parishes, they started to trend up. And we saw the same kind of pattern in the north and the west in June and into July. Where the pattern kind of shifted. You do have smaller outbreaks here and there. But overall, for the 4 months between March and July, you can see that the north and the west are the ones that are trending upwards between March and now, whereas St. Catherine has pretty much cooled off for the most part, except for communities here and there in Hellshire, Portmore, and so on. Now, trending can be trending up steeply or trending up gently, but it's still trending upwards. And it's important to show that distribution and planning across the country. Now, what we also did were rolling 7-day cumulative totals. We could also do rolling 7-day averages or whatever, but this essentially is a map that you're looking at right now. Every single community in Jamaica is represented here. You can see the red areas, red and blue and green. Those are the St. Catherine communities that spiked in April and sort of plateaued off since then. You do see communities showing a step-like increase, which is showing sporadic outbreaks here and there over the time series. But of concern in terms of prediction would be to see what is going on closer to July and June. Which areas are trending upwards in July and June? And you can see a few communities are popping up in the latter half of the latter parts of the time series, whereas for the most part, those spikes in St. Catherine have kind of flattened out. Every single community in Jamaica is represented on this one graph, which is why it looks so busy. But you can then begin to isolate which ones you want to focus on, which one is of particular interest to you as the parish municipal councillor, or as a minister, or as a church organization, or a chamber of commerce. You want to be able to see this type of information quite easily. What we have done now in terms of prediction is quite exciting in terms of looking at the movement of people. It is one thing to know where people live. You want to know where people go and how to track it. What you're looking at right now are 35,000 what we call origin-destination pairs, where people live and where they go, in this particular case, to access pharmaceutical services. So we have 35,000 pairs right here. And the red lines are the movement of people towards or from Crossroads. Blue is Halfway Tree. Green is Spanish Town. So you can see the movement of people and how far they go. On the inset map, you can see red is Montego Bay, blue is Mandeville, and you can see how far people go to access services in Mandeville. How far do people go to access services in Montego Bay and so on? And you can sort of begin to draw a line to show the area of influence of these people. And these are the mixing zones. Where you see Spanish Town people mixing up with Crossroads people, mixing up with Halfway Tree people, that's how things could potentially spread. That is how you want to see if a case, what is the probability of a case in Spanish Town reaching Mansion Hill or Morant Point. We want to be able to see what is the likelihood of these type of things here. This is by no means comprehensive, but at 35,000 pairs right now, we have a fairly large sample and an idea of where people are going and what they're doing. You do have people who go from Kingston to Montego Bay, but not on a daily basis to access services. So we're trying to get a grasp of what's going on with individual people, the vulnerable facilities, how people move, and of course the COVID cases that are sitting down on top of the entire country. So finally, we really have to look at the nature of scale. Scale is so critical because when you look at national information, it means nothing if you're trying to get a grasp of something in your parish. Then you want to look at, and we saw an entire lockdown of an entire parish, which is the largest parish population-wise. But that means nothing if you're trying to quarantine an Otter Bay, Enfield, or Dover in St. Mary. So you want to be able to drill down more and more and more, and the information needs to get more granular each time. We have to understand the nature of the space-time dynamics to look at and account for the role of the mobility of populations, but also how people mix in terms of where they go, what they do, and so on, and the type of activities and services that they access. But the final point I want to make here is the importance of contextual data. People are obsessed with primary data. You need to know the case number. You need to know the case number. I mean, if you have an alien invasion right now, I mean, what's the history for that? You need to prepare anyway. So what we have to be able to do is to try to account for which assets are vulnerable, which people are vulnerable, prepare for that. And then when eventualities happen, then you know what to do instead of when something happens, that's when you begin to prepare. So that's in a nutshell, our adventures in COVID for the past 4 months. Thank you very much for having me on.
Thank you so much, Dr. Lyew-Ayee, for your contribution and for the tremendous work that you and your team at MGI are doing, tracking and predicting COVID-19. I am sure, like me, the audience is impressed, especially with the scaling down to community and neighborhood levels, the space-time dynamics that show mobility and mixing of people. That data is powerful in allowing us to protect ourselves without shutting down economic activity. And this is commendable work, especially the section looking at identifying the most vulnerable among us.